Hello, guys. We are we are talking to Heather. She is a wound specialist. If you guys are not following her, she's absolutely amazing. And so I wanted to talk to her about. Okay, my dog is like messing with my stuff. So anyway, so she's going to talk to me about wounds and weight loss surgery. And so she is fabulous. She will look at any wound and tell you how it is. She's a physical therapist. Oh, there she is. Okay, Heather, you're going to join? All right, so let's get busy. Just met with her this morning. So awesome. Great. I'm
Great.
I'm looking forward to hearing about it.
How
Hey,
you
Heather.
doing?
Good. You just met with what?
Uh,
Good. Well, welcome. So, I actually I
oh,
actually intended for
I
you to
know,
lead
right?
this.
We're a pair. We'll go back and forth.
So leadership hat on, and then you start this off, but because you had all the questions and stuff, and I wanted to see all that all that you have and all the questions and what we can
Well,
say.
I know I always work with the folks who have some wound issues, and I've been seeing a lot of the clients I've been seeing recently have been having like body lifts and that kind of thing. So after gastric bypass, or now even we'll probably start seeing some folks after weight loss injections. So we had started just a
Yeah.
little side conversation about, is there something different that is going on? What nutritionally could we do to help support them? Because the wound part is one thing. You know, we would treat those wounds just like any other wound, but there's obvious nutritional deficits that are playing a role. So that's why we started chatting about it.
That's fabulous. And so I want to know because I'm sort of like you. I want to be very honest on this live. I'm still putting my toes in with weight loss injections, bypass, and wounds. So I want to just clarify when we come up here, we are medical professionals, but we're learning too because this is such a new
Yep.
navigation, right? This is like that's really new. And so, we kind of put our heads together to learn as well. Like, what can we do together to treat the client? What I was thinking of is, when you and I chatted, the one thing I was thinking of is when they're coming to you and you're giving them the treatment, how are you seeing like a slower healing, or like what are you
Um,
doing?
so I do mostly virtual
Or
consults. What I am seeing
right,
is if they've had massive weight loss, it's usually more than one procedure. So, they're having the bypass or I'm not really seeing the weight loss injection folks so much right now, but we're seeing the gastric bypass folks. And so then they go in for a tummy tuck, usually first. And then there may be the lower body lift or the thigh um, shaping, and then the arms. And so I'm seeing people kind of a few times. And so I recently just
okay,
worked with someone, and I had seen her for the tummy tuck, and then I saw her with the thigh lift, and unfortunately she had a dehiscence, so her wound failed, and I kind of pointed her in the direction to getting in-person wound center sooner than later
oh wow,
care.
right. And but does she healed
She
on
had
the
a
first
little, I mean,
surgery?
I never get to see the people that just heal. So I have a totally skewed perspective, but she had like a little issue with the tummy tuck. It was, I believe, a fleur-de-lis, and those are harder to heal just because there's more pieces that have to go together. Um, but yeah, I mean, I'm always talking about this is when they come to me for a wound thing, I'm like, now is not the time to get lax on nutrition. Now's the time to double down. Even though you're exhausted and it's been going on forever, now's the time to focus on the wound care. I mean, the nutrition.
Right, right. I have to switch you. I've done 3 lives, and my phone just like rapidly dies now recently when I'm doing lives. Let me plug you into a different thing. I don't know if you're
I just
experiencing
see
it
you
too,
like,
but
go ahead.
let me plug you in.
I'll see if I can read some of these
I'm just
comments. So I
gonna.
had a sleeve, lipo healed super fast back at the gym, 4 weeks. That's awesome. Glad to hear.
So like I said, I want to preface this by saying if we're still kind of getting into it, I think the one thing that I've seen is if I could, if I could put in my few tidbits, it would be I'd love to see anybody who's getting skin removal would be a solid year after weight loss surgery, at least 1 year. So see this girl, I don't know when. I would be interested to see when this girl says I have a sleeve 2020. Oh, and she just had it.
Yeah.
So you had it 3 years later. So something that I think is a great time frame because you are like you understand the diet, you have progressed the diet, you've been able to listen to your body, you're likely in a really good support system. Those are people who I think are the safest people when you're getting into weight loss, skin removal, and you've been like less than a year, even 18 months. I feel like that is when it's much harder because it, there's still so much going on those first 2 or 3 years after gastric bypass. Um, and you're still trying to like progress your diet. You're still trying to figure out, you're still trying to lose weight. Like a lot of people are still trying to lose weight, you know, even like 2 years out, 3 years out. I mean, I met a sleeved girl who did not reach her weight until 3 years in. So, so sometimes it's like I feel like they get them done a little bit too early and they should wait a little bit. I think that
So
would be
I
the
did
first
find
thing.
one research study while I was like trying to prepare a little bit for this conversation. So I found one research study and it was talking about post-bariatrics and complications. So, and about the skin removal procedures. So they said the difference between, there's a there is a difference between someone that has bariatric surgery and their skin quality. So someone who has bariatric surgery versus someone who just loses weight on their own with no assistance, their skin elasticity and turgor and the way that the protein makeup of their skin is different for someone who's had gastric bypass. And they said that the complicating risk factors are going to be if you smoke, if you have diabetes, and the amount of weight that you've lost. And your previous
And
BMI.
so
So if your previous BMI was like over 35, the amount that you've changed is going to affect the skin after. And then the complications were dehiscence, infections, and seromas. And dehiscence was the big one.
that's right. So I think, and to touch on that, that's really because when you have weight loss, as in for weight loss injections, and when you have weight loss from bariatrics, weight loss is like you're becoming deficient in it, but you can literally get a supplement and replenish those deficiencies. Whereas with bariatric, you're malabsorbing
Yeah.
those vitamins. And so, and because then you need, and a lot of times, they don't understand. I mean, there's no tests. There's a lot of not tests. Like you're not testing for riboflavin. You're not testing for thiamine. You're not testing for vitamin A deficiency. And so you don't know that you're deficient in them as a bariatric patient going into plastic surgery. And so those deficiencies thins out your skin, right? Vitamin D deficiency is very prevalent. That thins out your skin. Like you literally have like thin, frail skin. Vitamin A deficiency, copper deficiency, selenium deficiency. And I think that is why the
Hmm.
skin is different as well, because they're absorbing those vitamins. And so if they're malabsorbing them, then you're not going to have that strength to heal the wound on top of, protein deficiency as well. So the more that I had to think about it, I wrote down a few thoughts too. Um, Thinking about like if somebody's on here and they're looking for like thoughts about it, or even with you, Heather, at least my thoughts. And like I said, I'm touching my toes into this whole area, but I think number one is the questions to that I would ever want to ask would be like, when was your bariatric surgery? How long, how long have you been at your stable weight? And did you work with a dietitian? That's huge, because I've seen the people who are most successful, I have found, are the ones who had a really, really, really good bariatric dietitian when they had the surgery, because they understand general concepts, and they're pretty, like, they're on a good vitamin, they're consistently taking it. If they've had any types of eating disorders or disordered eating, that has come into play, and that's been like they've been in therapy for disordered eating, things like that. I think oh yeah, Charlie, if you want to chime in here, that would be good too. Um but I think that would be I think that would be the biggest thing. Um I think that would be the most number one. But the other one is if if they're going into skin removal, then I would look more also into like making sure that they're on bariatric supplements, but then starting to look into sublingual. Like I thought more and more about it, and I was like, if I have more bariatric patients, I would start putting them on some sublingual vitamins, because
Hmm.
sublingual is like underneath the tongue, and you immediately absorbed, and you don't have to worry about
Have
deficiencies.
you
And for the sake of surgery, I think
have you
one thing.
seen anyone with the like dermal patch vitamin? I had one client that.
And I've reached out to a few bariatric dietitians, and I'm like, what are your thoughts on these? What do you think? And they're like, we have not used them because we just don't know enough about them, and we don't know if they're helping. I have seen those though. And when I had a client who had iron deficiency, we were looking into those. Um, but I
Yeah,
was too hesitant to
and he
recommend
came to
them
me using them
because
and was like, I can't keep any food down really, so I'm trying to, it was like after gastric bypass. It wasn't with the
right,
skin removal.
right. Right. Wow. And so what do you think, does she think the vitamins were
It
working?
was like a better than nothing
Like,
situation, but he was having such a hard time
yeah,
keeping food down and finding and we had a discussion about
right,
um, the types of proteins and how difficult it could be, and that everyone's on powdered stuff. Yeah.
right. Yeah. It too was depends on how they were eating before. Is it all yeah, Charlie looked into them after VSG, and the opinions were so different. That was about that was about my pat. Charlie's actually my client who did multiple surgeries after bariatric, and she did phenomenal. But Charlie, how far were you out, Charlie? Is what like how far were you out between your bariatric surgery and coming to me is what I want to know. Um, but yeah, so that's why I think like with the dermal, I'm just hesitant because I'm like, this is surgery, and like I would put it on you, but then I would still say, I still would want you to take your gummies, and I still would want you to do sublingual because I know those work. And when it comes to surgery, it's so serious and deficiencies show up, like surgery, any deficiency
Hmm.
that you have is going to show up in surgery. You know what I'm saying? And so that's why I'm like, that's what gets me nervous. Oh my gosh, Charlie. Okay, so Charlie, you're the extreme exception.
Well,
And Charlie did
hopefully,
fantastic.
then all the other
Uh,
factors were probably good. Not smoking, not diabetic, otherwise healthy.
yes,
She's working with
was
you,
great.
so that's a bonus. Yeah.
True. And that's true. Um, and that's true. And to be honest, yeah, there was a lot of processed proteins in that diet too that that we had to address too. So I feel like it's just a whole thing. It says, oh, so Lisa said, I went to my bariatric surgeons before plastics and made sure all my blood work was good. And I absolutely took sublingual vitamins and I did vitamin IV drip
Yeah.
after surgery. Yeah. Yeah. And so the vitamin IV drip, that's like such a new thing.
It's
I
just
mean, not a
super
new thing,
popular
but
now. It's
it's
like
often not,
everywhere. And uh, even
yeah, it's definitely,
like I talked to a woman today and she was able to go to hyperbaric oxygen. Yep, like that
yeah,
used to be rare, rare.
for wounds.
Like you didn't, that wasn't just anywhere. And obviously, if you're rural, then it's going to be a little bit more difficult, and it's a huge time commitment. But if you're dealing with necrotic wounds, things that are opening and not healing, it's definitely, it's like throw
Yeah.
everything at it.
Yeah. And that's funny too, because flying out in California and she's doing hyperbaric. And I'm like, wow, that used to be saved for like cancer patients, non-healing wounds. And now they're like advertising. Like they literally sent me a text and said, you can go do a tour of our facility if you want. I was like, all right. But yeah, I mean, I have to say that even IV vitamins afterwards would not be, but they're not, it's hard as from like my perspective because I'm like, I really don't know how much they're regulated, but I know
Mhm.
surgeons who do it. And if I had, I would say I would go to a surgeon's office and recommend IV, the vitamin IV. So that's a good solution as well. Um, so I think in general, like, I had my surgery 1 year and 4 days after VSG. Okay. Yeah. Um, Hi, Imelda. Um, yeah, so Charlie was 1 year, 4 days. And I also think too, client who healed exceptionally well is she was like very receptive. Like, like we worked together. I gave her options and she did them, and I feel like compliance
Yeah.
is a very big thing too, about like asking them. And I mean they're dealing with so many things, right? So it's not like they're trying to be non-compliant. They're just dealing.
Yeah.
It's just a lot of things going on when you have a wound. Especially with that you showed me the thigh. Like you that's stress. It's a whole lot of stress. You know. Um. So tell me else. Okay. 10 months ago, I had lipo 360 and BBL with Dr. Marshall. I've gained 15 pounds and can't seem to lose. Oh yeah. Okay. Um. This is weight loss surgery. Oh, I put 360. I can't. Well, I mean, we're talking more about weight loss surgery right now, really. But maybe if you want to DM us in the DMs, we can talk to you. Cerrone 4386. So what kind of recommendations did you give to the thigh lift who was not healing after
Well,
weight loss
a
surgery?
lot of times, so wound dehiscence is going to be a factor, and usually with the thigh lifts tend to be like a difficult area. It's moist, it's dark, you know,
Um,
it's just like a hard area to dress, and then you've got to deal with, going to the bathroom and kind of disrupting all the dressings if there are dressings or the faja or whatever, or sometimes even using those urinal things that can be quite difficult. So you're risking infection kind of like every time you use the bathroom. But um, incisions early on need to stay dry. Um, and early wound dehiscence usually happens when the wound is a little bit ischemic, so it'll be darker, purpler, just not kind of cooperating like you expected. It might not be the whole incision, it might just be part of it. But a lot of times what I see with the body lifts and things like that is almost like the tension is a lot because they're trying to make sure you look good at the end. So they've remove a good bit of skin and kind of pull things tight. So especially with the thigh lifts, it seems to be like obviously gravity wants to pull it down and there's not much to anchor to up top. So, and with the gastric and the skin being different, I always think it's like trying to sew up jeans that are frayed. Like if your jeans rip, you can't really like sew it up very well. So I haven't heard back from her yet, so I'm hoping everything is okay. But I did open, and I knew she went to get medical care in person. So we'll see how she progresses.
So keeping it
Dry,
keeping it dry
reduce friction, keep an eye on it.
So
Hmm?
if she's a thigh lift and she's going to the bathroom, what do you recommend for
She was
that?
using a urinal. She was having a little bit of a hard time making it all work. I'm like, try sitting backwards on the toilet. I had another person that did a circumferential lift, body lift, so that's like the abdominal, and then it goes over the butt crack, and her whole like butt crack area, the whole thing, like it started to pull apart. So we wound up. Well, I always am needing to change people's dressing, so we need to get on a more advanced dressing kind of immediately when those things open up. Like gauze is not going to cut it. And
Right.
we were utilizing kinesio tape to kind of take some tension off the incision, and she did heal up. So yeah, sometimes we have to get a little bit more creative when the wound is in a weird position, and then we've got to make personalized choices and like what is happening for you. So a lot of times it's not going to be these basic gauze and honey is likely not going to cut it. And part of that I think is the skin is so different.
Right. Yeah. Right. Okay. Well, that's fascinating. So on my end, I would say making sure that they're at least a year out. But if you're actively seeing them, I would say making sure they're on like the gummies, the bariatric gummies, taking sublingual, B12, D3. That would be probably the biggest thing that I would say. And then even if, I never recommend collagen, but that would be a time when collagen would be great because it's dissolvable, and they would just add that to their drinks. Like instead of drinking water, you're drinking collagen water. That would be a time that I probably would add, that in as well. And then on my end, I would probably do more of like a calorie count as well, and then figuring out what they will eat,
Yeah.
on my end. On my end. I think the biggest thing, because, and as well as like, all of these vitamins are connected. So if you're on here and you're listening, you can't just do one vitamin, because one vitamin absorption affects another vitamin absorption, right? So copper and zinc and albumin, they're all connected. Calcium and vitamin D, they're all connected. So you start doing too much vitamin D, you can mess up your calcium. You just it kind of can become like this triple effect. So you have to make sure that you're taking a grounding vitamin, a multivitamin, and then if you're doing anything sublingual in the fat soluble world, like at the A or the D or the E, that you're doing just like you're doing, a little bit over the 100% RDA, because you don't want to get too much of that. You don't want to be toxic in that, because
And
then
that's
everything else becomes
for the
unbalanced.
fat soluble ones.
The fat soluble ones, A, D, E, and K. You just got to be careful of those vitamins. Um, and then, so and even in the bariatric world, I remember even long ago when we learned about it, they're missing what's called intrinsic factor, which makes them B12 deficient, which is an essential vitamin in the stage 2 of wound healing. And so that's when you want to do like a B complex sublingual if you can. But at the core of it, even though like everybody touches on what vitamins, at the core of it, it's usually always protein
Yeah.
calorie malnutrition. Always. So, like that's what that's always the missing key with almost everybody that I see, is it's like they're not just this is not happening because they're
Yeah, yeah.
deficient in vitamin B,
It's a
right?
whole
Like,
the whole
and
thing.
everybody that, yeah, I'm like, this is not your problem. Your problem is this. Like, this is your main problem. Let's focus on that. And that is where I find it difficult, because even with my bariatric patients who came to me for working with me, they were like, we need to work together on your post-op meal plan, because, it's not going to fit the sleeve patient
No,
population. So I was like, yeah,
yeah.
like, this is what I want. Let's do Um, and so it was just a matter of like, you have to have a meal plan after surgery. Like, you just have to. If you're a sleep patient, you have to have one no matter what. To understand like what, even if you don't eat it all, that you have a concept of how much you're eating, so that when it does pull apart, you're like, okay, how do I get more of, how do I get more calories and more protein in? And that would be, you've got to get calories in through your food, but then your drinks now are like no longer water, they're
Yep.
supplemental water, and that would be kind of way. And then I think too, I have not tested this out, but I got feedback from one of my VSG patients, and like, um, she was just like, there's no way that I could eat all the fiber and the protein that you gave me, you know? And so that would have to be where, we'd say, okay, we're going to give you the protein, and we're not going to give you as much fiber, we're going to give you a little bit more, carbohydrates, and, like with the rice and stuff like that. And then we may just give you fiber supplements, to make sure you're not constipated, it, it's I think that's where it becomes really, really tricky, and it's hard for you and me, because we're digital, we're virtual, so it's like, that's hard too. So, but the ones that I've worked with, I've learned so much with, and now looking back, I'm like, okay, this is kind of like how I would venture in it differently, seeing what they're capable of doing. um I feel like if any bariatric person is going through surgery, I feel like they should absolutely have
Yeah.
somebody with them nutritionally, you know, somebody to be with them to help them, you know. That's
I
my point of
agree.
view.
And if you have a wound, you need to like address it sooner than later. Yeah, and if your surgeon's
Yes.
not like
Oh, yes.
responding to you or whatever, or something starts to like look dark or open, like just make an appointment ASAP, because I haven't seen it where it just like resolves. Especially if you've
Yeah.
had
And I
if it's like a skin removal surgery, not just a tummy tuck, but
Right, right. And I do have to say too, and I hate to say this, and I wish it was like not the way to say it, but it was like, I mean, you're just at so much more risk for everything. So this is not something to like lay back on, this is something that's like, anything happens, you know, call your surgeon. Anything if you're bariatric, post-op, you know, that's what I would say, or aesthetic, any kind of aesthetic surgery, just because the risk is so much higher
Yeah.
of going south quickly, But know, I remember say that sometimes because they're like, oh, I'm so tired of saying my risk is higher because of A, B, and C. So I'm hesitant to say that, but at the same time, it's like, well, I mean, for the sake of just healing, that's I think that's really to be emphasized as well. Charlie says, and the hard part is I think every
Yeah.
weight loss person is different in what they can eat. Yeah. I mean, that's another thing, Charlie, that's a fantastic thing. Like I remember going with the meal plan with Charlie. And she's like, yeah, I can do this, this, and this. And then my sister-in-law who has it, she's like, oh yeah, there's no way that I can do, like, she can do drinks with solids, and then there's my other, she's my best friend and she had bariatric and she's like, yeah, I still can't do, like, she's like 4 years out and she's like, I still can't do bubbles. I still can't do carbonation. I can't mix anything. So everybody's different, for sure. So that's why I say if you're definitely getting bariatrics, definitely work with somebody. But and it doesn't have to be me, just any
Mm-hmm.
kind of bariatric dietitian, right? Like, dietitian and that, I think that would be important. Imelda, are you post-op? Are you post-op gastric? IB 1277? I don't know.
And I think we
I didn't know that.
haven't really, obviously the weight loss injections are very popular now and becoming more popular, and we just haven't really seen what the results will be yet. Yeah. So I would assume it'd be similar, but probably not as extreme unless they've lost like a significant amount of weight because they are taking the injection and also like not able to eat, because I get that comment a lot. Like they're barely eating. And I'm like, well, you got to eat something.
In the
No,
pre-op or the
like just
post-op?
in the injection world. Like they're like, I lost 30 pounds in a week because I can't eat anything. And I'm like, well,
Yeah. No.
that sounds great.
I
I mean, we all kind of wish we could wake up 30 pounds later, but
Yeah, I think that's definitely going to be interesting too. Shaper Zinc, you're on here, and she's a nurse practitioner, and I think she. So if you have any, thoughts on that too, she does cosmetic surgeries, and she's an MP, and she gives injections. But I agree with that. Like, I think some of the nurse support is like they give, not the nurse support, but the support with it is like we give meal plans. And it's like, well, I don't know if they need meal plans. I think they need to understand how to maximize food, how to maximize every calorie in their body. And I think that's the biggest thing. But I don't know either. Like it may not be as bad as what we think, right? It may not, they may bounce back and it may be fine. I mean, I really, I really don't know. I know people have been doing it for a long time, but it'll be interesting to see, what happens. But I definitely say that if you're doing the injections, it would be like, I would want to see labs as soon as possible.
I would
I
think
think that would
also
be the biggest
if you're
thing.
on the injections and you're planning for surgery, some of the similar things would apply, like having a stable weight for a period of time, um,
Yeah.
and all the other things. But probably
Yeah.
some weight stability would be good because the risk with the injections is once you stop the injections, the weight's going to return. So getting the eating
Understand.
under control, like how to eat, what to eat.
Right. Or and no, and two, I think I did a video too, like these are natural ways to make you feel full. And so it's like if it once the weight if the injection wears off, how do I make myself feel full? Well, here are some ways to make myself feel full, which is kind of what the injections do. And I got some pushback like, well, they just don't do that. And I'm like, well, I know they don't just do that. I know they work in different ways, but the result is they make you feel full. Like, you know, they produce hormones and they slow down gastric, moving. And I know that, but I'm like, the result is that they make you feel full. So I think sometimes is figuring out ways to make you feel full as well, before surgery. So I don't know. It'll be interesting. Like people have been probably doing it for years, and maybe this is coming up and trendy, and that's why we're talking about it. But it'll be interesting to see what happens with it. But Imelda, you and I have to talk then. I haven't looked at everything, but you and I should talk about all of that. Moving up. All right. Well, I gotta start making dinner.
You
But Heather,
can.
it's always nice to talk to you. Are you gonna come into my private group once I grow my
Sure.
private group and you're gonna talk?
Why not?
I I think I've already sent like two
I'll
clients to
talk to
you so
anybody.
far. Good, 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 good. I sent one to you. She said
Oh, okay.
she saw
Yeah,
you
yeah,
this
I didn't
morning, so
realize.
that's
Yep.
great.
Yep, we got on the phone today.
Yeah. Oh, good, 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 good. All right, all right,
Thanks,
Heather.
people.
Always a pleasure. You're one of my favorites. All right. If you guys have any questions for Heather, honestly, you need to, if you're having any kind of surgery, you need to be following her, just going through her, going through her page, because if you're not having surgery, it's always good to
Yep.
have her in your back pocket. And Heather, how do you work? Like they they send
I'm
you
on
pictures and how do you work?
Instagram probably the most recently. So an Instagram DM is fine. You can drop me a picture and I'll let you know if I can help you. I usually ask for a picture and a little bit about what's you've been doing to know if I could help you. And then if I can, we'll get on a private call and I'll help make a plan that includes like what you should use on the wound, and sometimes some additional stuff. So if I think like TENS units or red light, like if anything else, if I can think of anything else that I think might help, I usually include that as well. So not just the wound dressing, but all sorts of stuff. Hmm?
Are you doing red light
Um,
therapy?
I've started to mess around with it a little.
Oh, we gotta talk about that.
I got a
I have
device
questions
coming.
about
I'm
that.
gonna try it this week.
Oh, that's fascinating. Oh my gosh, I'd be so fascinated to see
Yeah,
how
I'm
that works
excited. I'm
for
gonna
you.
mess around with it a little bit on myself and a tummy tuck client I got coming in, and we'll see how it goes.
So exciting. Okay, well, keep me posted on that. That's fascinating. Okay. All right, girl. You guys have questions, follow
Talk
her. I'll
soon.
talk to you
Bye.
later. Thank you.